The most common symptoms for bladder cancer is having blood in the urine. Now this can be blood that you see, where the urine looks red, or it can also be microscopic blood in the urine too that you don't see, which is why it's important that people are going in and seeing their doctors, and that physicians are then taking patients who have microscopic blood in the urine and sending them on to a urologist to be evaluated. You can also have worsening urinary frequency, urgency frequency, and that can be another common sign or symptom of bladder cancer too. Unfortunately, there aren't a lot of other major signs or symptoms for bladder cancer, and as a result, especially in our female population, we have a delay in diagnosis because people thinking of other things that are causing those symptoms rather than having the light bulb go off and say, I need to watch this person for bladder cancer.
That's a fantastic point, Jonathan, because there are disparities that we have noticed in patients with bladder cancer, especially women, and we have a delayed diagnosis, as you pointed out, and we get the word out there that any blood in the urine, we call it hematuria, is a trigger to go get an evaluation, and referral to a urologist is a very, very vital part. And we're working with the Bladder Cancer Advocacy Network to get the word out there. Again, workup for bladder symptoms. Urinary tract infection can be a confounding factor, but it's good to have a good evaluation by the expert.
And I think one of the things that people just don't realize is how common bladder cancer is. All the time we have patients that say, I never even heard of bladder cancer. I didn't know you could get cancer of the bladder. And yet it's the 6th most common cancer overall. It affects both men and women. It is more common in men, but it does happen in women too. And so we need not just for providers to be thinking about it, but for individuals to be thinking about it too and educating each other about the risks and the possibilities of bladder cancer.
100% agree, and that's a very important point. It's the 4th most common cancer in men, 6th most common cancer with men and women together. And we have to make sure that people do not ignore symptoms and do as much as possible prevention, by not ignoring symptoms, but also having a primary care provider, having an establishment with internal medicine, primary care system, so they can have this access to care, which is very important, can delay diagnosis when it is needed.